Hi everyone, my name is Claire, and today I'll be sharing with you some of the findings from our research on benchmarking and variation in the use of antibiotics. So benchmarking originally started in the late 70s as a way for the manufacturing sector to reduce production costs and make more profits. And as one expert puts it, benchmarking is the continuous process of measuring products, services, and practices against the toughest competitors or those companies recognized as industry leaders. So this brings us to benchmarking applied to healthcare. So unlike the manufacturing sector, where making more profits is one of the main drivers, benchmarking in healthcare often involves caring for the welfare of others and the motivation to improve the health of the population, and doing so by improving the quality of health services. Users of benchmarking information might include clinicians, policymakers, who want, for example, to compare outcomes, such as post-surgery complications across different hospitals in the same city, for instance. But benchmarking doesn't stop there. It also involves an enabling environment where activities such as the discussion of benchmarking results help users better engage with this type of information and take the necessary steps towards better quality of care. So we were interested in assessing the impact of benchmarking on healthcare quality, and to do so, we conducted a literature review, and our findings suggested that benchmarking was positively associated with quality improvement. I'm now going to talk about a case study where we looked at antibiotic use in Tuscany's primary care. So the Tuscan health system has built an infrastructure where the use of antibiotics is promoted, as well as the adoption of best practices. And this is really to combat what we call practice variation, which is a variation in the level of quality delivered. And despite all these measures taken, our findings suggested that there was a significant variation in the use of antibiotics at the clinician level, which perhaps was reflective of a wide variety of practice styles. And it also suggested that perhaps a lack of engagement from clinicians with benchmarking information. So this brings us to future research that could look at different elements that can empower individuals, such as patients, clinicians, or policymakers, to more actively engage with benchmarking tools. Thank you very much.